My laboratory focuses on inflammatory breast cancer, which is the most aggressive and lethal variant of locally advanced breast cancer. Patients come in and they're younger usually than the majority of breast cancer patients diagnosed. And unfortunately, they come in with a disease that does not present as a lump, so it's very difficult to detect by mammography or ultrasound. And they are often misdiagnosed and receive antibiotics because their breast is red and swollen and it looks like mastitis or an infection. And so unfortunately the disease is so aggressive and so metastatic that they often have metastasis at first accurate diagnosis. MD Anderson was the site of the first inflammatory breast cancer clinic named for a woman who was 24 at the time of diagnosis and unfortunately 26 at the time of her death from IBC. So the clinic was developed in 2006 and sees a large majority of patients that have IBC, the time of first diagnosis through their treatment. So that's been a significant source of funding for research and for education and outreach for translational research, which is some of the first of its type in this area. So MD Anderson was the first site of an IBC clinic dedicated to these patients' care and research. There's now an additional clinic at Fox Chase Cancer Center that was developed by my clinical collaborator Massimo Cristofanelli, who was at MD Anderson and developed the clinic, and now is at Fox Chase as Director of Medical Oncology. And so we've been very fortunate to have Susan G. Komen Race for the Cure support. We were the first Promise Grant awardees, and Susan Komen partnered with American Airlines and provided $7.5 million to support our multidisciplinary team to do inflammatory breast cancer research. And one of the fun things about this is that I have collaborations across the country and across the world internationally that has allowed us to identify what we think are primary pathways that are very, very important that drive inflammatory breast cancer metastasis. Hopefully in the coming years will really decrease the number of patients that are misdiagnosed at early times when they identify that something's wrong with their breast but it's not presenting as a lump. And the other thing is that we're really at a very exciting time because we're finding that different therapeutic agents, targeted agents that are emerging from development from the pharmaceutical companies and from academic laboratories into clinical trials for primarily hematological disorders will find utility in inflammatory breast cancer as well as other solid tumors. So we're really at a very, very exciting point, and I am really looking forward to the next 5 years of this adventure.